Now, problems with low cholesterol. We already know high cholesterol is not a problem and doesn't change it. It just means that the body is under tissue damage. Blood sugar problems. Ooh, is there an elevation in diabetes in our population? Swelling or edema, mineral deficiencies, vital, chronic inflammation, difficulties in healing, allergies, asthma, reduced libido, infertility. Do we have medications to solve all of these? So does this mean lowering cholesterol or cholesterol-lowering drugs are implicated in these type of symptoms? Wow, that's scary. Now let's look at Dr. Beatrice Golem of San Diego. She had 98% of her patients taking her drug, cholesterol-lowering drug. She found out 1/3 of the patients suffered from muscle problems. Polyneuropathy means peripheral nerve problems. Okay, there's a problem with the nervous system. Tingling, weakness, pains in the hand. Researchers in Denmark, 500,000 people, okay, 9% of the population, they found that people that took cholesterol-lowering drugs were more likely to develop peripheral neuropathy. This is numbness and tingling in the hands. This means cholesterol is vital for normal immune system function. And in fact, those taking statin drugs for a year raised the risk of nerve damage by 15%. Took it more than 2 years, raised it 26%. Hugely important. Now here, statins and heart disease. Right now, we're having an epidemic of heart problems. In fact, if you look at it, congestive heart failure, it's epidemic. Deaths attributed to heart failure have doubled between 1989 and 97. Oh, statin drugs, they were introduced in 87. Okay, now, the main reason also that they're thinking that it's linked to heart disease, these cholesterol-lowering drugs, is because it depletes your body of coenzyme Q, which is vital. And the muscle, heart muscle, can't work without it. In fact, cardiologist Peter Langenstein studied 20 patients with normal heart function, gave them a cholesterol-lowering drug. Within 6 months, 2/3 of the patients had cardiac abnormalities. Do you think it's implicated there? Well, let's look at studying cancers. Okay, cholesterol-lowering drugs to date have caused cancer. Every study with rats shows that cholesterol-lowering drugs cause cancer, every one. Now this, I love this wording, we haven't seen a dramatic correlation in human studies because it takes longer to develop. Cholesterol-lowering drugs haven't been out that long. However, in one trial, it was called CARE trial. It was for breast cancer rates. They found out the people who took the cholesterol-lowering drugs, their cancer rates went up 1,500%. And the manufacturers of the drugs, they know that statin drugs depress the immune system. They know it can lead to cancer. They know it can lead to infectious diseases. However, they're now recommending cholesterol-lowering drugs for autoimmune disorders because they know it has an immune suppressant for transplant patients. So this is a new market. It's not just manufactured to force the blood cholesterol levels lower. It's, I know, insane. Now this is huge. A cup of blueberries a day is guaranteed to lower cholesterol. A cup of blueberries a day is guaranteed. However, the side effect you've got to be aware of is health. What this does, it's an antioxidant. This will actually go in and soluble fibers. It will clean arteries and increase immune system function. Can we write a prescription for this? Yes. Now, blood pressure. Okay, what is normal blood pressure? Anybody know? Okay, should everybody have the exact same normal blood pressure? Should my 83-year-old mother who smoked for 50 years have the exact same blood pressure as my 16-year-old son who plays paintball every weekend? What's common sense tell you? No. Okay, no, that's ridiculous. Well, let's look at this. Okay, first off, I love this quote here. Now, this is from the president of the American Institute of Stress, clinical professor of medicine and psychology. He says, a simple elevation of blood pressure is a reading on a machine. It's just a guide, okay? Tons of different causes. Okay, that's why there's over 100 drugs to treat it. But now, what's normal? And I love this. This is out of a regular medical textbook. And they show you normal blood pressure, and this is normal for everybody on the planet, regardless of condition. It should be 120/80. Now, if it goes up, okay, it's going to be higher. First off, understand what these numbers are. The first number is the output of the heart. The second number is the resting rate, or the overall existing pressure of the body. Now, if you have arterial damage or you get older, that first number has to go up. Okay, if you've had, let's say you smoked for 50 years like my mom, okay, she's going to have, and she's older, she's going to have hardening of the arteries, so that first number has to go up to allow blood supply to go to vital organs. Now, this is Harrison's medical textbook. This is common sense, but we don't follow it anymore. This is about 30 years old. The first principle of therapy of hypertension is the knowledge of when to treat and when not to. Oh my gosh, common sense. We actually bring thought into healthcare. A woman who has tolerated her diastolic, that's the second number, it's supposed to be the low number, diastolic pressure of 120 for 10 years without symptoms or deterioration does not need immediate treatment for hypertension. Brilliant. Common sense. Okay, we monitor the patient. Now, first off, one number is good for everyone. No, I don't think so. Older individuals with arteriosclerosis, that's hardening of the arteries, where higher blood pressure is needed to maintain adequate blood supply to the kidneys and other vital organs. In the old days, they used to say the first number should be 100 plus your age. So 150, 160, 170, all considered normal. Now, okay, just random chance number, roll of the dice stuff, they say it should be around 140 over 90. Really? Even for people over 70? The problem is, if you lower someone's blood pressure, they get dizzy. You can compromise vital blood supply to organs. You decrease their system function. Your body's a self-regulating mechanism. It knows what to raise or lower. Now there's and they're saying high blood pressure is a risk factor in strokes and in heart disease. Did you know there's over 300 different risk factors along with blood pressure? Or now let's go deep earlobe creases, baldness, selenium levels, pot belly, not having a nap a day, okay, having too much alcohol. It's crazy. If you start giving a person a nap a day, does that decrease their heart attack and stroke risk? Yes, it does. But it's just one factor. Now, one thing's neat. Does everybody on the planet have the same size arm? No. Okay. Now, do they have a variety of different cuffs at the medical doctor's office? Well, do you know that if you have, 2/3 of the Americans are overweight? This is important because if the cuff is too small, the blood pressure reading is going to be higher. You have to have the right cuff size for the right arm. Now, also, and these are other reasons that blood pressure could be elevated, wrong cuff size. White coat hypertension means you get a little bit of anxiety. Look at other causes of higher blood pressure, and this would be in a doctor's office. A full bladder, cold room, decongestants, over-the-counter drugs, smoking, coffee, emotional stress, full bladder. This is a great one. Talking. Oh, here. Talking during the reading can increase your blood pressure 50%. Yeah, I mean, it's backwards. Okay, it doesn't make any sense at all. Now, here, I love this one. At least 2 readings should be made on each separate visit, separated by as much time as possible. 3 sets of readings, at least 1 week apart, are advised before prescribing drugs. Is that ever done? Do they say, hey, look, your blood pressure is a little elevated. What I want to do is take it again at the end of the week. I want you to make these lifestyle changes. Know that a full bladder, cold room, all of these are factors. Do they do that with blood pressure? No.